proper beard.
Yeah, I'm envious, right? I want to go back to those good days. You don't feel like quite the same as a man without a good beard on your face.
You know, for as long as I can remember, for the longest time I had a goatee, but I mean, I've had a beard. I don't remember my dad ever not having a beard either before he passed. So
there was a time it was stigma, but now I think it's
the norm.
It's such a norm.
Yeah.
Such a common
You're
place.
inspiring me. I need to let
you got a good
beard roll, dude.
You could definitely fill it out.
Yeah.
Have you ever had a beard, a full beard?
I have, but after a while, just kind of get tired of maintaining it. So
it really is. It really is work. It's just like. Is that my phone?
It's what?
We're getting a phone call from Mal.
Oh my hell!
Way to go, Aaron.
I'm on Do Not Disturb.
You obviously don't have her on that.
Well, doesn't it blanket do it? Anyways.
So I'm Perry. This is Aaron. Why don't you gentlemen introduce yourselves?
I'm Jeff Fox.
I'm Jordan Harris.
So Jeff and Jordan own Pure Life Medical. And basically it's a one-stop tune-up shop for your body, right?
Absolutely. Great health and wellness. Yes, exactly.
See, all that time I was setting up, I actually was paying attention.
He's a tagline jingle guy.
One-stop body shop. Got it.
One-stop body shop. So tell us a little bit, guys. Tell us how you created it. Tell us kind of the story behind this.
Well, I'll tell you a little bit of that story too, because I've been working on this for a couple of years actually. And so we do have kind of a larger brand that's called Pure Life, but our clinics, we have 4 clinics in Utah. Ours is individually owned here, but we kind of have sister, brother organizations, if you will.
Got it.
And so we're all slightly different, but we do the same general things in terms of health and wellness, natural healing being really important to all of that. Helping people live their best lives.
Testosterone.
So hormone therapy, weight loss, into advanced healing techniques, and use of things like sound wave therapy and red light therapy, and all of the things that have this incredible scientific basis for effectiveness.
Right.
And so in that sense, there's a lot of things that we can do in any one place. But we're actually the owners here in Cottonwood Heights, and so this is our baby.
I like it.
Picked
I like
a good
it a lot.
spot.
It's a great spot.
I think it's a absolute
we
slam dunk spot.
We really love it. Lots of great folks.
I used to live just up the street, and our office is just down the street. So
Nice.
Great area. It was actually one of my favorite places to live, was here in Cottonwood.
Beautiful.
Yeah. Up on
Love
top of the
hearing that.
World Drive.
Oh yes.
Yeah.
Absolutely. That's a great place.
Can't beat these views, that's for sure.
Heck no, you can't. So we decided to come remote. I'll give you guys a little back history here. Travis on our real estate team, his wife actually works here, and we got to talking, and as we told you, we try to do at least one mobile episode every single month, and felt like this was like the perfect place, man. The perfect place to just come in and find out more about this. My own personal experience, I get the testosterone pellets.
Yes.
So I drive clear to freaking North Ogden.
Oh, wow.
To get them done at that northern, you probably know of them, short little stocky dude, northern, can't remember their name. But anyways, now that I know that you guys do that,
Yes.
this is quite a bit closer. And
Quite
I mean,
a bit closer.
I like it.
Test-
You don't have to take off a day to go get it handled.
testosterone pellets are testosterone pellets, right?
Yes. There's really two big companies that make them. And we like the supplier that we work with. They're just amazing. But one of the things that's really great about the specific type of pellets that we use is that what the testosterone is embedded in is plant-based, and it's less likely to be extruded. In other words, your body kind of
Reject
senses
it.
it and then try and push it back out again. So it's got a patent on
Oh.
how it's done, so to try and decrease that ability
Got
to
it.
push it back out again. Yep.
So the pellets are about that long.
Yeah, they're actually smaller, but they often chain them together. Yeah.
So
But yours might have been. That's true.
mine that I have are about that long. How
Yeah.
many do you think I have? They put in every time.
For you, I would probably guess 14.
Damn close.
Okay.
16.
16.
16.
Okay.
Yeah.
Yep.
Price is right rules.
Is it
Gotta
because
be
it's
right,
not?
yeah.
Is it
Well, it's both. They had to actually bump me up because it was.
Yeah.
the more he needs more manliness? Is that?
It's because he has so much
This
manliness. He needs more. Yeah.
Let's dose this guy up.
Yeah,
Well,
they were.
You can tell from your size, right, and
Right.
the amount of muscle mass you have, you're going to need a lot of testosterone
Yeah.
to feel good, feel optimal. So yeah.
And guys, I mean, let's talk about this. So when I hit 30 years old, my testosterone went in the toilet, like bad.
Welcome to the club.
Yep.
Pretty much everybody does that.
Isn't that weird?
Yeah.
And we don't realize that it's happening because very rarely do people actually test their blood work that will tell them exactly where their testosterone levels are at.
Well, and for me, it was, I mean, energy, sex drive, well-being in your mind,
Mental
Yes.
clarity.
mental clarity. I like it. It was a lot. So I started out doing the foamy shit that you'd rub on your
Yes,
shoulders. They
yeah.
probably don't do that anymore. I'll
They
leave that
do,
alone.
believe it or not.
They
It's a bad
they
way
have
to
the
do it, but
creams.
you can do it.
But think about it. You're rubbing this cream on, right? It's like, oh, did I put enough on today, right? Like, or what if you forget one day?
Or it rubs
Then
off
you come
on
to
your
the-
clothes.
Yeah,
next person.
long sleeve shirts.
Yeah.
You're going to experience this roller coaster effect. It's not very
And if you need a
sustainable.
lot, it's hard to absorb
Exactly.
a lot through your skin.
And you got to be conscious of rubbing off on other people
Yeah.
that don't
Exactly.
need it.
Yep.
Exactly. And don't want
Wives,
it.
girlfriends, right? Like, yeah.
Right.
They
That's
do
where I
not
was
want
gonna
that
go, but I
testosterone.
certainly
Yeah,
don't want
yeah.
Anyways,
All of a sudden, the girlfriends are having beards just
Right.
like you guys when they don't want it. Yeah, yeah.
voice goes a little dark. So then I graduated to the shots
Yep.
and was getting basically I self shot once a week with 1 milliliter,
Probably something like that. And
Yeah.
that's still very
and that
common.
stuff is like
That's
Very
what
freaking.
common.
that's
Yeah.
what I do.
That
right
stuff
now.
is
do that as
like
well, yeah.
syrup.
Yeah.
Like
Thick.
it's
Yeah.
thick. I had to actually use I called it a loading needle, which was a bigger gauge needle in order to get it into the thing. And then, of course, you don't just. It's not like a normal shot where you just slam it in. At least I didn't, or it hurt,
Yeah.
and
Yeah.
it would hurt for days.
Yes.
So you have to put it in slowly. The problem I found with that is you'd forget up and down
It's
and
a roller
up and
coaster ride.
down.
Yeah.
You know, when you first get it, you're like on fire and
Yeah.
conquer the world, and then by the time you get to the end of it,
Your
you're
next
like,
shot, yeah, you're back down to where you were before
right.
you were doing them at all.
So we went on, actually, this is an interesting story. We went on a trip to Hawaii that we basically won it from our brokerage for volume for the year for business.
Oh, awesome.
And while we were there, got to know some of the other agents in the brokerage, and this couple, Mark and Nikki, were talking about how they get these pellets. Mark was talking about it. And so I dug into it deeper. That's why I'm going to North Ogden, or have been, because that's the first time I'd ever heard about that type of a process or anything about it. And I knew that he liked it, and I wanted to go somewhere that I knew was safe.
yes.
So that's my experience with it, and I'll tell you, it's world of difference. And then another really quick side note: my wife going through menopause was a wreck. I mean, ups and downs and heat flashes, and I mean, you know it. You guys hear it every day, all day.
Absolutely.
And she also gets the hormonal balance,
Yep.
and it has been the best. I'm just telling
Good.
you, the best.
And the great thing is the stability of it. Because
Exactly.
once you just put the pellet under your skin, then you have months ahead where you never have to think about it. You never have to miss a dose. You never have it. You just have
Yeah,
a
because it's like every 6 months
steady
for
release.
me, or 7
That's
months.
exactly right. So you're just going to get exactly the dose you need pretty much for that entire period until finally the pellets will be absorbed by the body. But that is a much better way to go than this kind of
Oh,
up
my
and down,
gosh.
sideways.
And
yeah.
you know, on my wife's side, I mean, she was trying everything, guys. I mean, she had gone to specialists. I mean, she was miserable
Yeah.
and just couldn't get anything that would work.
We have clients that come in all the time, females that are in that exact same situation where they just don't feel like themselves.
Right.
They're tired, they're run down, they have no energy. That brain fog for women is huge. I think women are always smarter than men, so they can tell the brain fog much faster
Yeah.
than we can.
Oh,
right?
no question.
And so I'm thinking of this one lady in particular. She was like a brand new person. A week after getting her pellets, she came back in and she was just had this glow in her face again. She
That's
was just
awesome.
like walking on air, felt amazing. But yeah, like
It's been amazing for my
Yeah,
wife.
that's awesome.
I'll just tell you guys, good
Good.
show. So let's talk a little bit more about some of the things that you do.
That's just one layer of what you guys do.
That's
Yeah.
this is one little
specialties.
teeny tiny part
Yeah.
of
Yeah.
what you guys do.
Exactly.
So let's talk about cold and hot. I've got this. I've got it up.
Absolutely. Well, cold and hot is great because it's great for, well, lots of applications. There's almost everything we do has both physical applications as well as almost mental health benefits that come along with that in terms of your brain chemistry. And so hot and cold is probably best known for things like weight loss, as well as because the shock proteins that can happen with both hot and cold.
So let's
can really
explain
help
what it is. It's the cold
dry
plunge,
fat out.
right?
Yep.
It's the cold plunge.
And then
And then
into
a
a
sauna.
Infrared sauna. Yep.
So
Exactly.
do you get in the cold plunge and then immediately go in the sauna, or vice versa?
So you can do that. The only recommendation that we have is that you end on the cold plunge because your body. So the reason we like the cold plunge is because it's a delayed release of that dopamine, right? So you're going to get that dopamine over the next 24 hours. So if you get into the infrared sauna after the cold plunge, you're not going to get as much dopamine. Yeah, exactly. Getting in that cold water activates your flight or fight response. So you start to shiver, you start to shake, right? And that's actually what helps to strip that brown adipose fat, right? So great for your mental health, great for your physical health as well. But yeah, we recommend ending on cold. So yes, you can do cold, get in sauna, back in
How
cold,
many hours
call it a day.
after the cold as your body in that reaction, that response mode?
About 3 to 4 hours.
Yeah, so you're walking away,
Exactly.
carrying away effects that
And
way.
you're feeling good. Partly just
I've
because
only done it
you
once.
defeated the
Yeah.
cold. Yeah.
But
the other
the
part
hardest part
dopamine.
is convincing yourself how good you're going to feel after you get in that
Yes.
cold water.
It's like
And
running
how
a
long do you
marathon.
stay
it's great
in?
when you're done.
3 to 5 minutes.
Okay.
Anything
Yeah.
past 5 minutes, you'll get diminishing returns.
Yeah, I was in Mexico on vacation right around Christmas time. We were actually there over Christmas, and they had a spa that you could
Yes.
cold plunge.
Yeah.
Go to cold and hot. That's exactly right. So that's just one of the many things.
Okay.
Yeah.
So we talked cold and hot. We'll just moving along. We got
Yep.
metal aesthetics.
Yeah, so the medical aesthetics, we tend to focus on the things that only a licensed physician can be able to do.
Okay.
So those would be things like facials and injections that have to be administered by a licensed physician.
Botox. that kind of thing.
So it'd be the Botoxes, facials that include things like microneedling of amniotic fluids or PRP.
Okay.
And that's another common one. And you can also do facials with placental stem cells as well. And that's kind of the ultimate possible treatment because that's putting those brand new cells right into your skin.
Regrow that wrinkle.
Exactly.
That makes sense.
Yeah, it
Plump
can
it right back
really
up.
start
Yeah.
to have
That makes
a big
total
big
sense.
impact. So those are the things that we tend to focus on, and let some of the other locations focus on more the mid-range type of aesthetics. So we do the higher end aesthetics.
So you guys obviously have your own in-house medical practitioner. I don't know what you
do.
call them.
We've got several of them. And,
Okay.
And just a couple worth mentioning. So we have nurse practitioner who really focuses most on our weight loss patients and our hormone patients. She also does a lot of ketamine therapy, pain management, things like that. So that's kind of where she tends to shine and specialize, and she'll do the aesthetics as well. We also have another practitioner, is also our medical director, who's really an expert in more orthopedic pain management, joint arthritis type of issues, and he's especially good. He's treated thousands of patients with stem cell treatments.
Okay.
So we have all of our own protocols on how to do that, well. In some sense, if you were to, almost anyone could inject a stem cell. The question is whether or not you can maximize its impact for the next few months while those cells are living, they're adapting, they're helping you heal. And so we have really one of the best when it comes to things like that. So different specialties by our practitioners, and that's just a couple of things of interest.
Very
Yeah.
cool. Okay, on to the next one, red light.
Red light.
Red light therapy
Red
is
light, green light.
absolutely my favorite machine here in the clinic, right?
Really?
If you guys haven't tried it yet, you'll have to try it when we're done with this. But seriously, red
What's
light
it
helps
for?
with so much things. So it has so many applications, but primarily for us big guys, it helps reduce muscle pain, decreases inflammation, and increases circulation in the body. Are you guys familiar with DOMS? delayed onset muscle soreness after you work out.
Okay.
One of the best studies that they have is that pain can be reduced by 50% just by using the red light bed.
Wow.
But for females, they also love it because of the body contouring, right? So these lights actually penetrate our fat cells and help to loosen and break them up. So we put you on a red light machine and then we throw you on our shake plate and you kind of jiggle that fat through. It also helps activate your lymphatic system, right? Just to get that water moving throughout our systems.
Wow.
Right? Awesome stuff. They actually have a red light bed up at the hospital for their skin cancer patients.
Oh, wow.
Because it helps, helps develop collagen naturally in our skin. Wow. So women like that, so it tightens everything up.
So, and it's good for almost anything. There's
Lots
very
of
few
stuff.
things that you couldn't use the red light for. And because what it's doing is it's driving that light energy, only the healthy stuff, all the negative stuff is screened out, like ultraviolet. It drives that directly into your cell. That then activates your mitochondria, you produce more ATP, your cell is more active, it's healing itself.
Wow.
That's literally what's happening by putting that energy and that light into your cell, because what is death? It's when your cell can no longer function, no longer has energy. So it literally, there's very few things it almost can't help with, but some of the things that are the most well known for is the pain relief, and that can include pain from DOMs, But
So is it
just general
immediate or
pain.
is it something you've got to do over a period of time?
So it's just like a multivitamin, right? Like if you take it once a month, you're probably not going to see very many effects. So consistency is always going to be key. I will say this though, a couple weeks ago, do you remember I had that migraine coming on?
Yeah.
Hopped in the red light bed, came out, it was gone.
Oh my God.
So what do you
Insane.
recommend for somebody coming in? How many times? How often?
Depends on what they're trying to treat, but 1 to 3 times a week is plenty. Yeah.
Is it even known as a migraine remedy? I mean, I have friends that have. So I'm going to be pushing them this way.
Yeah,
for
for
that
sure.
specifically.
Here's the thing, each person is different, especially when it comes to migraine, right? So there's tension, there's stress, right? There's different types of migraines. But for me, it helped immensely. But when it comes to migraine, if you can get any type of relief,
Right.
that's so much better.
Right.
Just
Or you know
huge,
it's
huge
coming.
God,
you
I
know
don't
it's
get
coming.
exactly.
My
My daughter
daughter something
does.
like
Yeah.
that. Wow.
Absolutely.
Okay.
And so remember too that it's also increasing your circulation and decreasing your inflammation, and that's why that is so much of what ails us is
Right.
inflammation.
Inflammation.
And red light helps you decrease that inflammation, and
Well,
so that's why it has such widespread
it's
applications.
Body wide, because I
Huge.
haven't seen your machine, but it's like
It is.
You're
picture
laying in
something
the
like
whole
a
thing,
sun
yeah.
tanning bed.
Exactly.
Giant bed.
It
That's
makes
exactly
it makes
right.
sense to me because fat cells. Part of the problem isn't there's low circulation. By penetrating with that light, it actually what at least what I'm envisioning is it vitalizes the area, wakes it up.
Aaron, he said we could jiggle it off.
I know.
Did you hear that?
I'm gonna go do the jiggle.
Said he breaks it up and then we jiggle it off.
I'm gonna go do the jiggle.
We're going to film you guys jiggling to post it on the video at the end of
That's
this.
all.
Yeah,
That's
yeah.
right.
So arthritis, nerve pain, musculoskeletal pain, right? Any type of pain, those are the big ones.
And a lot of people
Very
just
cool.
feel better. Just
Yeah.
psychological benefits for anxiety, depression, stuff like that. So just consistently giving yourself light. I mean, think of it. That just makes complete sense.
Yeah.
Everything is light. Everything living on Earth is light eventually, and we're just driving that directly into the cell.
Especially coming out
Interesting.
of these winter months here in
Right,
Utah.
right.
Holy cow, we got
We're all
to get
covered
our
up. We're all covered up. We're
we need our
indoors,
vitamin
we're-
D. Yeah,
Exactly.
got to
Right?
get it.
Okay, PRP.
PRP. Well, I'll try and explain that one. That's
Yeah.
something again that the licensed physicians need to be able to do.
Okay.
So PRP is just the process of we take a blood draw, and what we do is we spin that down and process that blood, and concentrate all of the healing components of it, the platelets, the natural stem cells that you do have running inside of your blood. We all have some of them. We just don't have high concentrations of them. Is the only problem, or else we'd all be fixed and off to the races at every time. But we still have them, and if we can concentrate them and all of the other healing properties of the blood is then we can re-inject that into a site that we want to heal, right? So it's driving all of your body's healing stuff. We're just helping your body get all of those healing factors straight to the site. So PRP
from
can
your
be
own
used,
production.
Exactly,
So
from
it's-
your
so
own-
it's
from your
own
so
body.
is your
It's almost
body's
taking
kind
from
of-
the
all from your
good
own
and
body.
getting it to the bad.
Yeah,
area.
exactly.
That's right. We're just relocating it, and if you think of it that way, taking your healing factors and relocating it. And it's really commonly used in pain and healing type of applications. And so if you've had an injury, if you've got problems with your
Knees,
joints,
shoulders, hips.
My
like
hell,
this.
I needed you
Yeah.
guys about a month ago
Yeah.
because I did a remodel.
Yep.
On,
Oh, yeah.
and this 57-year-old body was pissed off.
I bet. Here's the thing. PRP, which stands for platelet-rich plasma, is going to become so mainstream because it really is your body's natural way of healing. We draw your blood. We
Sounds
spin
like something that the celebrities
super
would
fast.
do.
Well, you hear it all the time in the NBA and NFL. Oh, he just got a PRP treatment, right? We draw your blood. We put it right back in your knee, your ankle, your shoulder, your hip, and it just gives your body's natural healing properties to whatever joint is struggling and helps it heal that much faster.
Wow.
It's great.
And it
I'm
can
gonna have to tell
also
my
be
wife
used
about
in
that.
aesthetic applications
Right.
because PRP facials are actually a very common thing as well. So, and then what we can distinguish, and we'll probably talk about this here in a second, then is how that differs from stem cells, in quotes. And when we usually talk about stem cells, yes, you have your own, and PRP has your own stem cells in them. The only trouble is that for me, I'm 57, and my stem cells are 57 years old,
Right.
and they're not as
Potent.
stemmy and life-giving
Sprite.
as others.
Yeah.
They're not as sprite as some of the others, and not as concentrated. And so we can actually supplement that with placental stem cells,
They kind
which
of
are all
go
ethically
limping in to
Wow.
go take care of stuff.
donated. So, and that is really amazing stuff. So we can either wait or we can talk about that now. Whichever
Yeah,
you
let's go to Soundwave.
Yeah, let's do that. So Soundwave is literally using exactly what it is. Soundwave, sometimes called shockwave, but that sounds scary. So Soundwave, what it does is it penetrates beneath the skin, and it creates a little bit of micro trauma in, say, a tendon or a tissue. So again, you come in complaining of this is hurting, this is needs help. Sound waves can help by creating irritation at a very specific location beneath the skin, wherever that injury is. And so what happens when your body gets that inflammation or that little bit of damage, and it's just micro, it's
Goes
very
to work.
small. It's all right, your body starts pulling it back in. So again, it's another way of reconcentrating all your body's healing to that site and speeding up that process. So Soundwave, again, all these have just incredible histories as far as effectiveness and scientific studies and things like that. So, but this one is just completely non-invasive. We don't even have to draw your blood. We literally can it just sounds like a little click happening.
Now, do you combine it with others like, say, the red light?
Yeah, that's actually
process?
kind of the specialty.
Yeah.
Is we actually will combine multiple things. And so, say for example, someone has ED or something like that, and some of these things are, and people might have heard of Soundwave for ED. Well, that's great because it does have a very good application there. But what we'll do is we're going to marry that with, basically another 5 other modalities that also have the similar impact. So some places might, treat your ED with just that one thing, and that can be helpful. But different people are going to respond differently, and so we're going to marry that with really 4 or 5 other different things. So
Very cool.
You're exactly
I'm
right.
hearing is you guys, you have multiple approaches.
Yeah.
You look at all of these modalities, but you look at it from different vantage points and have all the kinds of
Exactly.
different solutions. For it.
So we're going to get you the sound. We're going to get you the blood factors. We're going to get you the oxygen. We're going to get
Wow.
you
Red
the
light.
lights. We're going to get you all the things that are helping your cell function. And so we're talking about all this in
Like I
terms of
said, a tune-up.
exactly. and the way we talked about it so far, it's almost like you're coming in sick, and so we're going to help you. Yes, absolutely. That's a great application. But all of these things also have kind of age
Maintenance.
age maintenance. It's keeping you from aging too quickly. So it's anti-aging applications as well.
Wow.
And so keep that in mind. A lot of people now
Can you make a guy like me look younger?
That's right. We can bring it. No, I'm just kidding.
When you're younger, you don't think about this stuff, but as you get older,
Yeah.
you start appreciating some of the slip that's happening.
This stuff
It's
can
like,
slow down that aging process. 'Cause
Yeah.
aging
Right.
is cellular dysfunction.
That's a holy
essentially what
grail,
it
man.
is.
We're sitting
yeah.
in the holy grail.
we are.
Yeah, that's
So
exactly right.
for you, when you played football, what would they do when you'd hurt a knee or a shoulder or a hip?
We would. There was a trainer. There would be ice and heat.
Okay.
There was also stem therapy, so shock therapy.
Okay.
Localized shock therapy.
In my day and
some,
age,
and some massage, I guess.
Massage as well. Yeah.
Massage is good too. Yeah.
But I
Did they ever do like the cortisone shots to numb you or the steroid shots?
I never got to where I had to have.
Good
but
for
I know
you.
That was
That's
available.
good. Yeah.
Yeah. But no, I didn't.
It's oftentimes that's the first thing that we turn to is, I just want to
Right.
numb the pain.
Right.
Numb the
But it's
pain.
not necessarily if you're
They
numbing
can
the
do
pain,
more damage.
you're still exactly.
can.
You're going to
Yeah.
do more damage in there.
Cortisol, it totally is a band-aid. But
Yeah.
It also it further causes a problem, doesn't it?
It does. It can. Yeah, that's the thing. It is viscous. It's hard to run through the joint, right, and stuff. Again, it has its place, right? If someone is in excruciating pain, right, that totally makes sense. But if you're just looking to add years to your knees, right, and shoulder and back, our sound wave and our red light are going to give that to you in a natural, holistic way, right? We can do a PRP treatment and that sound wave treatment, and that knee is just going to feel so much better.
Yeah, in that other case, they're just injecting, get you back up.
Exactly, yeah.
So-
Let's numb you up and get you back on the field.
Well,
Yeah,
Jeff
for
would
sure.
appreciate this because we're the same age. Back in my day, they'd just give you a salt tablet and boost your ass back out on the field.
Out there, yeah.
Absolutely.
Like,
There you go.
tell you,
Toughen
suck it up.
Suck it
Don't
up.
be a wimp.
That's exactly right.
Okay,
Be a
next.
man.
Well, technology's invented after you guys.
Right.
That's true, yeah.
Thanks.
Hormones.
All right, so in hormones, yeah, we did mention those a little bit before, and you can kind of see on the screen, I think that you're broadcasting too, is that,
Yep.
just how steady that pellet therapy really is and how it just
Yeah,
gives
we
you
kind
that
of already
nice
talked
evening
about
dose.
this one.
So
Set
we
it
did
and
talk
forget
about
it,
that one.
yep.
But the nice thing is too, it has, I should mention this too because we didn't talk about it before, it's not just helping you have more energy in your life, getting your libido back, feeling better about yourself, things like that, decreasing anxiety, has all these different kinds of things. But there's an additional benefit to having your hormones balanced, and that is it actually wards off specific kinds of major deteriorations in your body. So cardiovascular disease, coronary
your heart.
artery disease in particular, is lower in people who keep their hormones optimized. Alzheimer's is lower in people who
That's a
keep
big one.
their things optimized. Osteoporosis is lower in people who keep their hormones
Especially
optimized.
for women, yep.
Certain cancers are lowered in people who keep their hormones optimized. And so those are really important to remember too. It's not just making you feel better, it's literally a little bit like an insurance for how you age from here on out and what tends to develop coming next. It's better to keep that body in balance in the first place and fix that hormone imbalance. You know, and again, yeah, when we were growing up, you know, that's just aging, that's just life.
Right.
Get over it and deal with it. But it's a little bit like saying, you know, you're hungry, get over it and deal with it.
Yeah.
It's so fixable. No,
Right.
you go and you eat and you get what you're deficient in. And hormone therapy is literally nothing more than that because we're all going to get hungry. We're all going to lose our hormones. And if we can just keep them balanced and keep them higher, it's going to make us happier in the here and now. And it's going to protect us against disease. And that, and it all relates to weight loss too because you're going to have weight gain when your hormones are out of whack.
Let me ask you this. So I'm noticing the older I get that afternoons I start getting the depleted energy, kind of brain fog. I don't know if I'd call it brain fog. 'Cause like you said, women are way smarter than us. And anyways, the bottom line is I feel myself just like I'll start eating candy because I'm just looking for the rush, you know, to get my energy back up.
Yeah.
So what would you tell a guy like me?
For energy. Okay. Well,
Energy in that brain fog where you just feel like you're just like your brain's tired.
Yeah, we need to get you repelleted. No, just kidding. But that is one of it because
I am due for my blood test, by the way.
Yeah, and that's actually that would be one of the best things to check because again, it has this whole body impact. But as far as afternoon lagging, there is other things like your blood sugar levels and stuff that could affect that we probably should also be looking at.
Right.
And so that's where we would just match you up with the doctor, have the doctor really kind of figure out what's going on there. And so that would really be their call with I say doctor, but our practitioners are
Well, and that happens to be look,
etc.
Did you like how I led
Exactly.
you right
Absolutely.
into that, and I didn't
Exactly.
even know I was because the next one was medical diagnostics.
Oh, okay. Well, that's a really good one. So obviously we're going to be able to test your blood, but we're really going to start with some biometric testing. And almost everybody that comes through, we're going to run a biometric scan. It uses 4 different kinds of electrical tests to not only look at your body composition, but also to look at how your heart is functioning, whether or not your circulatory system is functioning well. And we can also see things that might be problem areas
Vertebrae.
in your spine and your vertebrae and also in your brain. We can see fatigue and things like that in your brain. So we really have everyone do that. We can also do multiple scans and view things over time and see whether or not you're going up, things are getting better, things of that nature. So everyone goes through that. And then if you have certain symptoms that require blood testing, of course, we're going to take that next step into the blood testing phase, especially for hormones, the only way to know for sure. But we're not just going to look at your testosterone either. We're going to kind of do a broad panel to find out what's happening in your chemistry in general. But of course, the hormones are going to be a key part of that.
Yeah, you know, I mean, when they did my first blood work, like they took, I don't know how many vials, but it was a lot.
Yeah.
And my wife actually printed off the results.
Yes.
And I'm not kidding you guys, it was a stack of papers that thick.
That's amazing.
All
That's
the blood
great.
work they did.
I love that because it just gets a comprehensive view of what's going on, and they can see other kinds of triggers. You know, you're often going to see people with thyroid problems, for example.
Right.
Well, it's related.
Guys,
but
prostate.
still a separate issue.
Prostate.
And so it needs to be treated in a slightly different way. So there might be multiple things. So that base is going to be hormones, but we're going to see other things going on potentially too. And that's something that the provider will be able to talk with you about. And we're on the verge of doing a couple other different kinds of testing too. We haven't quite rolled it out, but almost any day now. So we're going to do much more in the DNA testing world because that is, no, we can already do that today actually, but we're going to start doing it in a little bit different way. So DNA testing is one of those, but also microbiome testing. A lot of people, we don't know what's going on inside
gut
of our
health,
gut. It's
exactly.
the most
Gut?
mysterious
Gut?
part
Gut health
of what's going on. And so we're about to introduce microbiome testing as well. And the nice thing too about this is we'll be able to aggregate those tests using basically a mobile app. We can get a snapshot of who you are, what your microbiome looks like, what your DNA looks like, what your blood looks like. Now, knowing all those things, how do you live your life?
Pieces to the puzzle.
And now we can use algorithms to say, okay, well, you probably should avoid this food. You should eat more of those. You know, and actually be very directive in giving great health advice to people. So that's something we're working on. We haven't quite rolled it out yet, but we'll be rolling it out.
I've had heartburn since I was a kid. I take a heartburn pill every single day, and by noon, if I don't take it, I'm getting heartburn.
Wow.
Isn't that crazy?
Oh, man. Yes. That's crazy.
That's gut biome, isn't it?
Yep.
And yeah.
All
last
related,
one, stem cells.
Stem cells. Well,
stem cells is a good one, right? We actually just had your guys' colleague in.
Yeah.
He recently had a back surgery, and he's looking for additional help in getting that back right. So stem cells
I know he's struggled with it for a long time.
He has struggled.
Just had his surgery.
Yep. It's such a great guy. Couldn't have happened to a better guy either, right? We love Travis. But stem cells are undifferentiated pluripotent cells that once they're entered into the body, your body tells them exactly where they need to go, and they can become whatever your body needs. Whether it's muscle, joint, tendon, cartilage, bone, they can become any type of cells that your body can produce. It's literally the future of modern medicine.
Wow.
Very, very cool stuff.
You can do that here.
Absolutely.
Wow.
Yeah, we do that here. Jeff had mentioned previously our medical director, his name is Stephen Cox. He is an expert in stem cell therapy. He has developed a fantastic protocol to help keep those stem cells working and functioning properly. You know, with follow-up treatments that include PRP, the red light bed, sound wave machine, everything just to give those stem cells enough time to do and focus what they need to do. If you think about it, a back injury like a herniated disc, that's a serious injury, right? There's a lot of stuff going on there that needs to be repaired. So these stem cells, they need their time to focus on and get that done. But we love the stem cells here. Have seen such great results.
So just last week example, we did back injections to help with that surgical. So post-surgery is one application of that. They're also something that's really nice pre-surgery, or if surgery is just not the right thing for you. So we did treatments as well on somebody who really has bone-on-bone hip problems.
Yeah, we
and
talked
so
about an older person.
Exactly, and surgery is just it's too risky
Yeah.
to do a hip replacement at an older age and things like that. So they're looking for some way to help relieve just the agonizing pain and misery that they feel in because they can't really get around and it's just really disruptive to their lives. So rather than surgery, obviously this is something that we can do that has some hope of actual regeneration. It's one of the only things you can do to really get regeneration of lost tissues.
So I have a nag or something. It makes sense to come in here and go, hey, let's talk about it.
Exactly, right. But the other thing too is just a lot of people will talk to, well, I'm supposed to go get my knee replaced sometime soon. Well, that's a big commitment. You can't come back from it. And sometimes you need it. That's fine. When you need it, you need it. But if you can either put that off for 5 years, 10 years, or maybe not have it at all, the stem cell therapy is one of the few things that can possibly help you put off that type of surgery. So our medical director is actually going to be giving a talk on that and other issues this coming Wednesday.
May
We'll be
1st.
having-
May 1st?
This
Yeah,
is May
6:30 here at our clinic.
6:30
Okay.
here in
Yeah.
the clinic, and he'll be
Can
speaking
we
on
come
what
out
these
to that?
applications
Absolutely.
are.
We could bring some people.
Absolutely, yeah.
absolutely.
I have several people I'm thinking of that
Yeah.
I'd love to bring out.
Yep.
Love to have guests. We're inviting anyone in the community who wants to come and can hear from somebody who really knows how to do this stuff in the right way. And so he can talk about kind of where it works. It's not going to work on everything. There's certain places where it may not work, but he'll know exactly what those places are. But so anyway, that's just what's exciting to be able to see that help.
Do you guys play pickleball by chance?
Yeah.
So
Some.
I want to share my stem cell story. This is about
Good.
5 years ago, right? I was playing pickleball with my wife. I swear I wish the story was better.
And I don't know if
I could cover the whole court, yeah.
I don't know if you guys can see that this guy's like 7 feet tall and
Hey,
he's
if I
big-
was 7 feet, I'd be in the NBA. I'm only 6'7", but yeah, it
like
feels like that
Roy D.
sometimes.
Mercer would say, "How
Yeah.
big a boy are you?"
Yeah, I'm a big boy for sure. So I was out playing pickleball with the wife. I go to plant. I hear a pop in my foot.
It was
Right?
her foot.
No, yeah, I wish. Crushed it, right? So I hear the pop. I go to the doctor, get the MRI. He's like, "Yep, you've got a grade 3 tear in your peroneal tendon, right? That's the tendon that's responsible for your foot not going like this, wiggling back and forth, right?" And so he says, "We got to do surgery. Surgery involves breaking the bones in your foot, reattaching the tendon, resetting the bones, and you're in a wheelchair for 12 months."
Sounds awesome.
12 freaking months. Here, mind you, my wife we had just gotten married, like our second year to marriage. She was pregnant with our first kid, and I'm like, I cannot do that to my wife. Like, she'll literally have 2 babies on her hand. Yeah, 2 babies, right? Like, so I start doing some research, and I find the stem cell company. I go to their seminar. I learn more about it. I end up getting the stem cell shot, right? I'm in a walking boot for 2 months. 2 months, mind you, and I'm at this time I'm 6'7", 320, right? I hadn't lost as much weight yet, right? So there's a lot of pressure on that foot. After 2 months, I take off the walking boot. Foot's good to go.
Wow.
No pain, mobility's all the way back. I go back to my doctor, and he's like, "I want to see the MRI to do it." He gets the MRI. That tendon is completely healed.
Wow.
Amazing stuff. And I'm like, well, how
That
come you guys
obviously
don't
was
do
your
this?
entrance into this.
Exactly.
Into this
Yeah.
field.
That's
one,
what-
one application.
Just one application.
Wow.
Yeah, exactly.
So what would you guys say to the naysayers? I mean, there's always naysayers. There's
Sure.
always, I mean, my sister actually does this same exact, she has a clinic down in Arizona.
Oh, nice.
But there's always those people I've heard mixed reviews about stem cells, and I know I think my mom has actually done some stem cell. She's got major mental stuff.
Yeah.
She's 80.
That's a great question. So first and foremost, we love our relationship with our supplier, right? They're actually local here in Utah. So we know the type of quality stem cells that we're getting, right? So that's what I would say to the naysayers. Well, what type of stem did you get? Where did it come from? All of our stem cells come from umbilical cord and placental from pre-planned C-sections, right? So these are first-time mothers giving birth, and it's a pre-planned C-section because the C-section is less trauma than a traditional birth, right? They also do a health
So
screening.
do they just opt into that?
They opt into it. Yep. They're
Oh.
willing to donate it to it. Yeah. And the lab actually makes a donation to a charity of their choice.
Very
right?
cool.
Yeah. Very cool stuff. But they do a health screening 3 generations up. So the birth mother's parents, grandparents, and great great grandparents.
Wow.
The other nice thing, and I don't know how political you guys are or whatever, but I personally love it. These donors have never touched a COVID vaccine or shot ever. Right.
Huh.
Just
They're screened for all sorts of diseases,
so many
hepatitis,
things.
et cetera, things like
Wow.
that. So,
Yeah.
so they really carefully.
serious.
They're
It's
very
very
serious,
choosy
yeah.
about
Yep.
Right.
about this.
Who they'll
exactly.
take from.
Yeah.
And we know those stem cells are going to arrive live too, and because
They're
it is a
viable.
problem sometimes with other suppliers that they don't actually arrive alive.
That's a good
So-
point. One of the things they do prior to shipping is they will pull out a sample of the stem and test it to make sure the stem cells are still viable.
Yep.
Because they are cryogenically frozen, right? And so once they're shipped here, we thaw them in preparation for the procedure. But yeah, they're viable. They're moving. There's over 1 billion cells inside the vial of stem. Yeah, it's amazing stuff.
Wow.
And as far as naysayers, I mean, no one is saying that this is the be all and end all of everything.
Right.
So yeah, if people are
I
overstating,
did call you the Holy Grail.
Yeah, that's true. High marks to live up to for sure.
everything has limits and everything has applications.
Right.
Right. So if someone is going out there saying, "Yes, I have depression. I'm just going to take stem cell," well, that's a pretty weak linkage. I'm not saying it couldn't have an impact, but you don't want to be making promises about something like that.
So I've
That's
heard
not
if you're
well
bone on
researched.
bone that stem cell can't help you. Is that true or not?
Unfortunately, so
If
that's
you're-
not
when
true.
You're depressed
Yeah.
because your hip hurts and you can't get up
Yeah.
or walk.
Right, because your
Yeah.
life
I
is
have a feeling
miserable.
that would affect your.
Absolutely.
That's what.
For sure,
And
totally.
We have a lot of ways to tackle that. I'm just saying that
Yeah,
I cannot
yeah.
promise you that the stem cell is going to fix that,
Right.
right? That's a crazy promise.
To answer your question, the gentleman that was bone on bone with his hip, literally 15 minutes after, so we did his stem cell shot, then we put him in our red light bed. He was like, "I swear the pain is going away." Right? The stem cells respond
about
to
now?
pain
What about
activators.
today?
So it'll be a week out on Wednesday. He's coming back and he's going to do a follow-up PRP treatment,
Okay.
follow-up sound wave treatments. Again, red light bed.
I'd really like to follow up and find out what
Absolutely.
if it really truly did and does help him.
And here's what I would
Because
say
I mean,
too.
bone on bone is bone
Yeah,
on bone.
It is.
And it's the hardest thing in the world to deal with. And
Right.
again, even in all the conversations with him, we're saying we cannot promise you anything, right? Because you really can't, because everybody's different. But in terms of things that have any hope for you, it's kind of the only thing left.
Right.
Well,
when
I
you're
mean,
bone
if you
on
really
bone.
face it,
Yeah.
surgeries are not
Yeah.
guaranteed.
Stem cells or
Nothing's
surgery.
guaranteed.
You know, I had shoulder surgery because I had a bone spur
Yep.
that was hitting a nerve
Right.
that sucked.
Yep.
So going to the surgery, during the surgery, and I didn't even know they were doing this, they actually disconnected my bicep because I guess there's not enough room for them to go up in and do what they've got to do.
Oh, wow.
Anyways, the long of the short is, and I'll take my blame on this as well because I wasn't the greatest patient for follow up and
Therapy, PT after.
PT after and all that. I went, I did it, but I didn't know that they had actually severed my bicep.
Wow.
So today, my bicep has re-separated and is bunched in a ball right here. So my point being is that surgery isn't a guarantee either.
Right.
Nothing. There's literally nothing that you can promise that it will ever have a 100% result. So yeah, you can often put too much, expectation into something. So and our provider is incredibly careful. Honestly, he does multiple conversations with people, and he can just as easily say, you know what, I don't think this is right for you.
Because it's a lot of
I don't
money.
feel good that the probability is high for you.
Right.
And I'm going to tell you that right up front. It's just not a good likely candidate.
Hi, how are you?
So there's places where it's been shown to work well, and others where it's weak evidence. So
All righty. Well, we're at 42 minutes, if you can believe that.
that's amazing.
Do you want me? Okay, I just put up.
Actually, one thing I want to say
Yeah.
about this, so the part that gives me confidence
Yeah.
is how considerate, how approachable. I would feel comfortable to come here.
I would too.
that.
I love
Thank
it.
you.
No,
Thank
but
you.
that's important
Yeah.
because when you're staring down this list of things that could be potentially going wrong, because as we all age, things are slipping, things are happening.
Yeah.
It's
Jordan had to step out because we actually had a
Yes,
client walk in.
we had someone walk in. That's
It
exactly
can be
right.
scary.
Yep.
It can be scary.
Oh, the
it
whole-
can be embarrassing. It can be.
Health going
It is.
downhill is
Yes.
scary. So I've got the Pure Life Steps to Peak Health up. That's
Yes.
your big chart thing.
Yeah.
So this is a big overview.
It's just really an overview of our philosophy and kind of our range of services. And we kind of start on the bottom there of that graph.
Yeah, the
With
purple.
testing, because a lot of times, it's just covering symptoms or we can't help you. or we can't
Identifying the
do
problem.
anything. Look, let's just try and see if we can get to the bottom of what's going on here. And so testing is really important to us. And then from there, we kind of have this set of gradations
Testing's
of things.
responsible.
What's that?
It's responsible.
Absolutely.
Right?
We got to know what's going on. I mean,
I
yeah,
would wanna jump
giving
right
you
to stem
interventions
cells. I'd be
without
like,
knowing
"Shoot, give us some stem
would be
cells."
weird. That
Yeah.
just doesn't make any sense.
Yeah.
And so we talked about kind of the range of testing that we're able to do, but also that'll be growing and expanding. So we're really excited about that. And then it starts to go to, well, what can I do to really reduce my aging, make me feel better, really feel better, look better? Those are the things that people really want to feel. And so what do you do? All right, so one of the first things on that scale then is going to be essentially weight loss, because that will tank your health faster than everything, and you're not going to feel good about yourself. So it affects everything in your body. So obviously that's something we have to think about, worry about, and help people with, help them get there. And so we have, not only weight loss peptides, which are kind of the hot thing, that a lot of people talk
What
about.
about Ozempic and
The
these shots?
Ozempics and stuff like that. And so, yeah, the common names for them is semaglutide and tirzepatide. They work really well. They've got great research base. They don't always work for everybody, and so we do have other ways of trying to approach that. And sometimes people have a little bit of side effect, and maybe they don't want to take it anymore, or something like that. And so, because it can sometimes make the gut feel kind of strange and weird. So we do have some other options on what you can do, but we got to get hold of our health, because if we're overweight, we're gonna be sicker. We're gonna feel worse about ourselves. So anyway, that's why it's kind of like there, kind of at the base of all of this, is because it affects everything else. But then after that, it's like, well, we also put hormones down at that base too, because again, those hormones are going to affect whether or not you are gaining weight. They're going to affect your psychology. They're going to affect your physical performance in so many ways. And so these are just basic things that you really got to tackle at that level. And then kind of moving up the stages, if you will, of towards peak health, we're increasing the types of interventions. And so maybe we're starting to tackle very much more specific problems. So we can bring all the natural healing stuff, like the red light, like the sound wave, like oxygen therapies, like things like that again are basic to your physiology. Those are incredible natural healing factors. They're not surgery, they're not drugs. The longer you can stay away from that, the better. Someday it may be required, and that's fine. But most times we rush there too quickly, and there's better ways to do this. And so the natural healing, and then you can get into the more advanced healing we talked about with stem cells and things like that. Then there's who else are you? Your mental health, stuff like that. And that's why, we have a couple things. One that's really super low intervention here in the clinic. It's called the Neurovisor. It kind of helps people with their psychology, getting out of their heads, getting out of their ruts, and helping to kind of regenerate some of their brain function. There's some non-intervention ways, but there's also things that are more deeper psychological, I guess, which is like the ketamine therapy, that again can help you process through difficult things that have happened in your life. And so there's the mental health portion of that is also really important to us. And then kind of at the top is the aesthetics. Now maybe that's
don't forget the sexual health.
Maybe that's everywhere. Oh, sexual health. Yeah, we haven't talked about that.
That's on there.
Well, weight loss hormones. That
I was just going to say, I love that sexual health is at the top.
I leave it at the top, just because not everyone has that problem per se, but when you do, the nice thing is there actually are things to do about it. Now, you might have tackled that back down at the hormone level.
Right.
You might have actually taken care of it. Now, sometimes, though, it might require more intervention. So again, we talked about the 5 or 6 different types of interventions. So we're just going to really put that together. And that's not just for men, but there's women too have sexual dysfunction as well. And so you've probably heard, about things like P-shot, O-shot.
Yep.
Those are actually brand names, and so we just call them vitality shots here for men and women. And so, but they're the exact same principle. And that is, again, but it's healing around your organs, basically, so that you can get, better sensitivity, better performance, things like that. And most of those are done through a PRP treatment. That's what a P and O shot actually is. So it's a PRP that we talked about before,
right?
Injected into those private parts, which sounds scary, but it's not that bad actually. So I've had it done because
I'll take your word for it.
I do everything our clinic does. Yeah. And so it's not that, it's not as scary as it first sounds.
I'm scared of shots in my wiener, dude.
It sounds scary, and I'll be honest, I'm like, oh, I don't want to think about this. Right. And then you do it, and you're like, oh, that wasn't that big of a deal. So, but the same is true for women. We can do those exact same things for women. There's also things like, a large prostate, urinary incontinence, things like that a lot of our modalities can really help with. Mm-hmm. And so, if you're unhappy in that area, that's part of your life,
right?
You have to be happy in that area of that area as well. So we're prepared to help tackle that one too. And now I don't know if it's peak or not, or if it's all throughout all of this, but just loving your look, feeling like you're looking as good as you can. A lot of those things we talked about can help you look better. But then there's just the generic or well-known aesthetic, kinds of practices that'll happen. And again, we do the ones that are a little bit more higher intervention, like, say we're not going to just do a facial or a face scrub or something like that. That's all good, but that's probably better done in a different location. What we're going to do is do the stuff that's really medical in nature, and so it's going to be using those advanced healing factors in facial, things like facials or hair restoration or things like that. Getting all of those regrowth things that we talked about really focused on those other areas. Maybe, so it can be your hair, it can be
And I know we
whatever.
talked offline a little bit, but that's also all of this has stem cell applications
Yeah.
potentials as well. Right?
You do, and those are actual areas that have good application because again, it is a cellular growth issue, and so yes, you can choose to do that with a PRP application, or you could add in the placental stem cells as well as another possible layer to that, maybe increasing, amping up the power of that. All of them are good, and that's the nice thing is you almost can add stem cells where it makes sense. And there's certain times, of course, we're not going to say it does everything, but there's a lot of places where it's shown great research outcomes. So, anyway,
wow,
that's kind
that
of
was a lot,
That's
dude.
our
And
stair step of peak health
Long
wellness.
and short, if
Yep.
something's not feeling right, looking right,
I mean,
Yeah.
they've got. It
This is-
sounds
Let's
like
talk
you've
about
got
it.
something for everything, at
There's
least
a
to
lot here.
try
And
to figure it out.
And our practitioners are gonna get after it. And
Okay,
figure out
one
what's
more
happening
time.
with you.
When is your where your practitioner is going to be talking to everybody? Your presentation.
So this will be May 1st. That's this coming Wednesday night. We're here at our location in 1844 East Fort Union Boulevard in Cottonwood Heights. So we'll be speaking at 6:30. So come and join us, and we will probably try and repeat these, maybe even monthly if possible, just because it's gonna be talked about a lot more since some of the regulatory issues have changed a little bit in the state of Utah. So there's going to be a lot of people interested in it, and we want to make our experts available to the public to come and hear what's new, what's hot, what works, what's not.
And maybe somebody in a group
Yeah.
setting is scared to ask a question, and somebody
Then we
else
can
does,
do
and
a-
they get an answer.
We'll just get a private consultation if that's the case.
Yeah.
If they don't want to talk about it
until this
openly publicly.
conversation, I thought you had to pop on a plane and head to Mexico.
That's commonly the
Yeah.
case because what we see, that's what we visually see. We see advertisements for stem cell packages in other places. Well, they're actually completely legal, but there's been you can't really talk about them that publicly up until this point in time. It's always been kind of kept a little under the radar, but they are available. They're all produced here. All the research is going on here. It's just that in another country they could advertise. And one last thing that other countries do, which it really can't do in the U.S., is they will take their stem cells, their live stem cells, and they'll actually replicate them and grow them in petri dishes, and that's not allowed in the United States. We just use directly harvested actual stem cells.
That
rather
sounds better than having
generating-
them.
than manufacturing new stem cells.
Right.
I'm not saying it's good or bad, but either way, they're the same cells. So they're getting in. If you go to another country and get them, they're probably getting the stem cells out of the United States anyway.
Yeah, wow.
So you don't need to go traveling to find this stuff. You just need to come.
You just
talk
need to come to this
people.
address right
You
here.
need to talk to people who do regenerative medicine. Yeah, that's what it comes down to. Yep.
Wow, that was a lot of really cool stuff,
That's
man.
a lot. Yeah.
Jeff, we appreciate it a ton. Again, your company is Pure Life Medical.
Yep.
And right here on Union Park, 7200 South,
Yeah,
or Union,
Fort Union
Fort
Boulevard.
Union,
Yep.
7200 South, 1844
1844 East.
East.
Yep.
All right, guys. Well, thank you so much for joining us. If you have questions, if you have questions about this awesome topic we talked about today, just give us a shout and we'll put you in touch with Jeff or Jordan, and you can come and ask your own questions.
And
Wonderful.
friends, if you were interested in coming to this, I'm going to be here on
Yeah.
Monday, next Wednesday.
Awesome.
May
We'd
1st.
love to have you.
Yeah.
Yeah. The more the better, because this is really useful information, and it may or may not be right for any particular point, one person at one point in time, but you should know about it because it really is a powerful intervention. Yeah.
Love it. All right, people. Thank you so much for joining us here on Beards on the Street in our little mobile episode, and we will see you next Friday.